And needless to say, before I indicate what is done, I take some of our local periodicals. Rural hospitals strained in COVID surge is a well-known story. And then Delta surge crowding Texas Medical Center. We're in an internal disaster across the entire medical system, and that is both public and private. I came to this hospital to hear their story. They are about 36% COVID. They have a very full COVID patients. There are only 2 ICU beds left, and they have a tent that is on the other side of that overhang that is prepared to take COVID patients, and they could help other hospitals, but they do not have nurses. Mr. Mills is here with me, and so I spoke today to the Secretary of Health and Human Services. Let me say that again so it can be edited. I spoke this morning to the Secretary of Health and Human Services, Secretary Becerra. I've spoken to Region 6, FEMA. I've spoken to the headquarters of FEMA, and I knew that what was required was not happening in this state. And so I have written the governor of the state of Texas that his inaction is causing the suffering of the hospital systems here in this community. I wrote to him to say, I write to request your urgent action to indicate to the federal government that Texas needs emergency relief and to activate your emergency management team to help both urban and rural counties with healthcare systems that are now in medical collapse because their hospitals are in an internal disaster caused by the influx of patients infected with the Delta variant COVID-19. Every resource and asset of the state of Texas government is needed to stem the tide of death that the state is facing and critically ill patients. So the request that we are making is to ensure that the governor ask for crisis nurses, to ask the federal government, because the presidential emergency declaration is still in. Just about a couple of months ago, maybe a year ago, they were able to get crisis nurses. The medical center needs crisis nurses, small hospitals need crisis nurses, and Ben Cobb and LBJ need crisis nurses. So let me just read, you know we work from our cell phones. Let me read the response that I got from FEMA to indicate that it is imperative that the request comes from the state, the governor. As for the hospital concerns, cities and counties must still work through the regional medical committee to coordinate resource needs with FEMA. That is a state agency to work with FEMA. I checked today, and the only request we are currently processing for Texas is a request for 5 mortuary trailers. I'll continue to monitor as much as I can to keep you informed. The only request that we have from the state of Texas are 5 mortuary trailers, and that is to take the dead bodies of those who have died and succumbed to COVID. We are back 1 year ago when we had mortuary trailers in South Texas, mortuary trailers in New York. That is the request. Yet our hospitals are requesting crisis nurses. And the governor needs to respond. Just last week, I convened Houston Community College Nursing Program and Lone Star. Both of them agreed to work to provide student nurses. We are hoping to see those student nurses, some of them, come to hospitals like the public health system and as well small hospitals. They will be under the supervision of nurses like Mr. Mills, who has 40 years of service. We hope that we will utilize them, but we know under medical protocols, student nurses can do so much. As I spoke to nurses inside, they indicated that they're in the midst of wearing PPEs. It's important to make sure that the hospitals have enough PPEs. That is part of the state's responsibility. The federal government will not act unless they get a request. We have heard nothing from the state's emergency management. as of today. We've heard nothing from the governor as of today. Let me be very clear. My intent is not to be in contention and controversy, but it would be remiss for the powers that I have and the work that I do and the word that I have gotten from my Department of Health and Human Services to not convey this to the governor and to those who are in need. And that is one call or one communication to the state to get the emergency management to be working and provide these various necessities. I also want to express my shock and disbelief that the Texas Education Agency seems to have provisions dealing with mask mandates and schools that indicate that there will be no contact tracing and as well that there will be no need to notify parents. We have funding in the federal government. We've had it from the spring of 2021 to provide direct funding to help jurisdictions do contact tracing. You're not going to tell me if a 5-year-old, a 10-year-old, 8-year-old is COVID positive, that it is not the obligation of the school to let the parents of that class or that gym or wherever that child was, an innocent child who cannot be vaccinated, to let the other students know. I am certainly going to challenge that and ask the federal government what relief we can get on that, because I'm stunned that that would even be a suggestion in this state. There are 7 states that are the hot spots. Texas is one. We've heard that Texas and Florida represent 1/3 of the COVID cases in the nation. The numbers are not going down, they're going up. And so let me offer this letter to the governor in the spirit of the crisis that is called upon. You wonder how I am engaged, because I received a call about midnight. I started texting from a desperate hospital that was getting drop-offs from innocent EMS. You can't blame EMS who are desperate to get a patient to a hospital. You can't blame them. But I want you to know that there are patients being dropped off at the community's hospitals that have to be rejected or have to sit in a lobby until a nurse can be assigned. Not a nurse that's sleeping, not a nurse that is inattentive, but there are not enough nurses. And so you have hospitals, even the public hospital, that people are in hallways. And I'm very grateful that every effort is made to deal with the people in the bed as the people in the hallways. And they are in the hallways. I want to make sure that the governor answers my letter. We've sent it ASAP this morning. And you need to understand that all he needs to do, as I have found in my conversations, which I already knew, but I wanted to have it confirmed, is the federal government has not heard from the governor of Texas or the government of Texas to ask for emergency relief, which would include crisis nurses or the ability to find nurses from other states and then be able to be reimbursed. It's a lot of money to get nurses, to get them in, but we have the money federally to reimburse. This hospital cannot on its own make the phone call. Congresswoman Sheila Jackson Lee, not on her own, but she has made the federal government aware, and they have told me, Congresswoman, we are ready, but we have to hear from the state. And that can be the Texas Health and Human Services, any representative of the state, that we need nurses in rural Texas, or we need nurses in this multiple populated, multi-layered and heavily populated urban center. Now let me just have Mr. Mills come and just briefly say a word about his profession and the hard work of his nurses in this hospital. He is 40 years in the service of being an RN. He is a registered nurse.
Thank you. Thank you. I guess number one, I want to say thank you for your presence and the attention that you're bringing to this pandemic and to what I believe will urge the governor into action to get us crisis nurses. I think that many things have happened that have benefited us as a result of this pandemic, one of that being telemedicine and how that has taken people from the EC and perhaps seen them in their home. But I just want to say thank you for the attention that we've gotten today. Thank you.
Let me just finish by saying I want to thank them. I did tour the emergency room and areas where people are waiting inside the hospital, where people are being treated with all respect to the protocols. We did not engage with any patients at all, but we were given a very good understanding what nurses have to contend with. They're on the 7-to-7 shift, so that means these nurses have been working 7 to 7 for a number of days, maybe sometimes longer than they usually do work. I was taken aback by the COVID tent that is ready to be operable, but no nurses to operate it. That seems like we can remedy that right away. I came over here because I think we're in crisis, and I came over here because I had firsthand knowledge, being on the phone at 12 midnight, about patients being dropped off in a variety of hospitals that could not be taken care of immediately because of the fact that there were no nurses. They ultimately got taken care of. That's what hospitals do. That's what professionals do. But think of your loved one. The last thing I want to say is there are other sick people. There are people with broken arms. There are people with gunshot wounds. There are people with strokes, heart condition, cancer. There are people giving birth. All of this comes to a hospital like this particular one or our trauma units in the medical center. And they are teeming with people because COVID is on the rage. So I'll be happy to take any questions right now.
First question here, you addressed the criticism of Governor Abbott not responding to the COVID crisis that we're having right now, but also additionally, the second special session is starting. A lot of people are asking what's going to happen next. Will Texas Democrats show up? And with your knowledge, also with the voting bill, what could possibly happen in these next coming days?
Well, I want to stay focused on the crisis, the hospital crisis. I'll be happy to answer that question, but let me just see if there are any other questions dealing with the hospital crisis, and I'll be happy to answer you.
Okay, there's also another question from KPRC. A child has to be transferred out of this area to another hospital in Temple. We've also heard that it was because of the shortage in beds and ICUs and pediatrics in the hospitals here in our area. Are you concerned that we are not going to be able to treat children or adults too due to the lack of beds and also lack of nurses?
And I'm going to let Mr. Mills answer it as well because he sees it. Absolutely. I know that it was a toddler. The mother had to drive. The baby was airlifted to Temple because there was not a bed. That's the very point that I'm making, that as I understand it, we're seeing children, sick children, because they are not vaccinated under 12. Some are over 12, of course, and they are not vaccinated, and that they're not an adult. So yes, I am fearful of the increase in COVID-19 of children who are impacted by unvaccinated adults. And their little immune system does not allow them to be as strong a fighter as they should be. And the toddler was very sick. Thank goodness the toddler has, as I understand it, is on the road to recovery. Their resilience is there, but they can get very sick. And if we don't, raise up our numbers of vaccination, we've heard some very low numbers in the Hispanic and African American community, and that's another element to our crisis. But if we don't, yes, I believe, and we were with Dr. Hortez of Baylor College of Medicine, and he has indicated that the crisis of infected children is going to be steep going through the summer and as they begin to go back to school. They too may have to come to a hospital. Do we not have enough beds for them? If we had an example of a toddler having to be airlifted to Temple, then the answer is no, we do not have enough beds for them. And what compounds that problem is not enough nurses. Crisis nurses can alleviate that, because I have faith in hospitals and being creative in how they do their patient distribution, that if needed be. But if you don't have a nurse to at least do the initial care and working with doctors, then you have a serious problem.
I think that point in particular, we've got Texas Children's Hospital as well as Memorial Hermann Children, who was unable to accept the patient because of capacity. And I think the fact, I'm thankful that the baby was able to be airlifted and taken care of there in Temple, Texas. I think it draws something else I'd like to make a point of. So we discharge about 30 or 40 patients a day. In particular, Friday, in this one unit, they had 8 discharges. Of those 8 discharges, we asked each one, do you want to go ahead and get vaccinated before you leave? Everyone declined. For whatever, I mean, our population, 90% seems to be Hispanic. We're not able to get through, for whatever reason, to that community to get them fully vaccinated. The Delta variant isn't going away. It's only growing. And I think even if they got vaccinated today, we're still talking about 6 to 8 weeks before they would have relative immunity. So it's a big deal.
And sir, what's your first and last name?
Yes, Richard Mills, RICHARD MILLS. I'm a nursing supervisor here at LBJ and have been for the last 9 years.
Any other questions?
Congresswoman, in Florida, school districts are going against the governor resolution of not mandating masks. Here in Houston, last week, HID said the same thing. On Thursday, they're going to vote on that. And he's asking other school districts to follow suit, put more pressure on the governor.
Well, there are two things. I have written, my earlier letter went to the governor to ask him to waive any penalties against local jurisdictions, the city of Houston, and the school board, if they determine that there is a catastrophic circumstance. I have not read specifically the basis of HISD, but I can project that it will be the 4th largest school district in the nation. They predict it may be catastrophic because the Delta virus is extremely contagious. Children will be coming from homes of unvaccinated persons. I think it would be shameful and sinful to penalize a school district or a city that is facing a catastrophic medical collapse, meaning children infected in schools. And everyone knows that masks on children, vaccinated teachers, which I understand most our teachers are vaccinated, can help to bring down that particular level of danger. So I've asked the governor again in my capacity as chair of this committee, to waive his particular penalties against those who would, for basis of emergency, implement the need to wear masks. And I think parents who are concerned, every parent has a right to put a mask on a child. I want them to know that it is not prohibiting them, but I think the school district feels that it is necessary. As I walked in the hospital, obviously, everyone is wearing a mask. They give masks to patients if it doesn't impact with their medical treatment. But the real question is to not have the jurisdiction, the governmental entity, suffer, and I don't think they should. But I've written that, and I've called the governor's chief of staff. I'm waiting to hear from him. I'm not in any way have any desire to get anything but action. Get action, and I'm good. But I think the other point that I will make is that I will be asking the Department of Justice, if they can, since there is a mass order from the Centers for Disease Control for individuals who are inside vaccinated or not. That has been issued by the Centers for Disease Control, which is a federal entity. And so I would ask the Department of Justice what protection they can give to jurisdictions who are complying with the Centers for Disease Control mass order. It looks like they should be able to protect HISD and as well the city of Houston if necessary, so that that mass directive could be put in place. Any other questions? I do. Can she come over here to ask? No? Let me, I know that you will, provide bilingual interpretation, but if I can speak from the heart, and simply to the Latinx Hispanic community, your numbers are very high. You are my familia, and I've always said, mi casa es su casa. In my Spanish, your house is my house. But we really beg of you, ask your priest, ask your faith leader, really begging of our families in the Hispanic community to get vaccinated, or to let their 12-year-olds get vaccinated, because it is extremely important to save lives. And we are finding out that the less you're vaccinated with this infectious Delta variant, the more you may suffer, more children may be infected, and it may impact your entire family. I think it's stunning to note that the only request that has come from the state government are 5 refrigerated mortuary trucks. That means that we're going backwards to not have enough funeral homes and enough space for bodies. That's a year ago. Are we getting ready to have that again? And we will have that if people are not vaccinated. That's my plea as a friend, as a mom, and as a member of Congress that has a very diverse community that includes the Hispanic community. It is a very deep-hearted plea. Needless to say, the African American community's numbers are low as well. And I want to make a plea for everyone to get vaccinated and not think that you can be self-sufficient and you don't matter. And you were saying 8 people who were released from the hospital, and were they COVID?
No, they were non-COVID.
They were non-COVID, so they had another chance, and they all rejected the vaccine, which has been proven with so many people taking it. And I think there are 3 vaccines, Moderna, Pfizer, and Johnson & Johnson. So there is no excuse. I don't know how much more I can plead. And I just ask faith leaders to engage with their communities. I ask people who are vaccinated to engage with your family members. And I ask teachers as we go into the school, personally speaking to families and talking to young parents about getting vaccinated. Yesterday at one of the public housing, I vaccinated a lot of young women. And when I say I, they were vaccinated along with people in their 80s. So we're still having to find people to get them vaccinated. So I will, any other? Thank you very much. This letter has been received already by the governor. It's notice from my office, and all he has to do is to activate his emergency management in the Texas Health and Human Services Department, and we could get these nurses right away. I'll come to you. Right. Okay, I'd rather do. Okay. So, all right, I'm finished with.